Hello friends, can you see me? Am I audible to you? Tamil we all are fine. One motivation, good evening. Tamil good evening. Welcome. Am I audible to you people? Am I audible to you? Shall we start the session? Nice. Welcome Naga Karthik, Argon Memes, Raji Chandru, Sonal Pradhan, Swarnalata, Growth and Achiever Motivation Success, Sherlock Tripathi, Balaji Ramasamy. Amazing. Naja Ahmed, very well played. Thank you so much for joining us. So this is target INI-CET Menti based quiz. So when I say Menti based quiz, it's a very simple option. As you are online right now, please open menti.com in your browser. Please use menti.com in your browser. I'll type it here on the phone right now. Yes, good evening all of you. Go to menti.com on your browser and use code 2322933. Go to menti.com on your browser and use code 2322933. And I have typed it here. Yes, Ramya Ramachandran. I am telling you the same. Go to menti.com and use your code 2322933. And why is this important? Because right now we all are preparing ultimately for the INI-CET preparations. So that would mean to say that we have to become more competitive. And in this particular order, when you go to menti.com, you will be able to answer questions for marks. The speed with which you answer and the correctness or the accuracy with which you answer will be taken into account for you to be on the top position. Now, this is just the introduction. Let me take just 1 minute to introduce myself. I am Dr. Meenakshi Sundaram AS, experienced 11 years in teaching, and these are all my achievements. You can have a look at it. This is just to tell you the idea of who is teaching you right now, and I'm the best motivator and the teacher award winning. And I have placed successfully every year for the past 11 years. I have placed people in PJ Chandigarh, JIPMA, AIMS, and most of my students have been in the top 10 ranks every single year, and I'm a quiz master for the last 11 years. Okay, and this is about the plus subscription that you are looking for in case of Unacademy. Just bear with me. Let me give you this introduction. This is mandatory for me to tell you. And you have daily live classes, you have structured courses, you have live tests and quizzes, and unlimited access to all the kinds of subjects. And remember, plus subscription will give you much of value compared to any other platform. Here you will be having 100% unlimited access to all kinds of classes, all kinds of faculty, and all kinds of tests and discussions. And you can get a particular 10% off if you use my code DRASM-YT or simply DRASM. When you use the referral code DRASM, you will be in for a 10% discount and exclusive access to all my special classes. There is something called as Iconic Subscription. You can have the best of live classes from Unacademy and the recorded classes of Prep Ladder. Using the same code, you will be getting 10% off. And this is about the daily T20 test for NEET PG 2022 and 2021. For example, if you're targeting 2021, you can take up the live test on Unacademy NEET PG every day at 8 p.m. Please remember, it's a free live test. You don't need a subscription for that. You can daily attend 20 questions at 8 p.m. and you can see where you stand at the national level. And if you're targeting 2022, then you can take the test at 9 p.m. You have a different set of questions for them. And we'll be having free live classes on 17th. That is on Tuesday at, I'll tell you the timing sooner, on 17th at 10:31 p.m. we have analysis of microbiology questions, a real-time mock question paper. Microbiology 30 questions will be discussed on Unacademy app. Please be with me on 17th 10:30 p.m. on Unacademy app, okay, not on YouTube, Unacademy app. And this is how you can use the code Dr. ASM. You can search for the particular app, then open the app. In the app, you can go for plus. In plus, you can go for get subscription. And once you go for get subscription, you can have both the concepts of iconic and normal subscription. And this will be the area where you'll be going for 10% off by using the referral code of any educator. So we'll start with the quiz right now. Let me come back to the first area. Go to menti.com 23. Give me a minute. Am I audible to you people? Am I audible to you? Yes, thank you, Raji Chandu, Nag Karthik, Varudan Rajgopalan, Shubham, Aman Agarwal, Priyamudan Preetham, Bharti Velan, Sri 17. Yes, thank you very much. So we'll start immediately. Excellent. So I would request you to go to Menti based quiz. You can see something on the screen right now. I request you to go to menti.com. I'm writing it here. Please go to menti.com and use the code 2322933. Use the code 2322933. And as you keep on logging, let me tell you the same thing here. This is Dr. Meenakshi Sundaram AS, experience of 11 years in teaching, MBBS, MD, MS, MD, DM, MCH students and aspirants for the last 11 years. I've been teaching biochemistry and microbiology. This session is about INI-CET exams and target is INI-CET. This is a Menti based quiz and it'll be microbiology based questions. Now, let me tell you about the Plus subscription. I'll make it faster. And we have Plus subscription, daily live classes, live tests and quizzes, structured course and unlimited accesses. You can use the referral code Dr. ASMYT. It is given here, either Dr. ASM or Dr. ASMYT. There's something called as Iconic Subscription. It's a combination of live classes of Unacademy with that of the Prep Ladders videos. You'll be having rapid revision courses and your own live lecture videos. And there are free live test series on Unacademy for people who are targeting 2021 and those who are targeting 22. If you're going to target 2021 January exams, then you have a live quiz at 8 p.m. every single day, and it'll be a free live test. You don't need any subscription. If it is 2022, then you have a live quiz at 9 p.m. If you're going to target the next year's NEET PG, you have a live quiz at 9 p.m. This is also free. And let me tell you, on 17th, this is about the schedule for free live classes. On 17th November at 10:31 p.m. we have analysis class for microbiology exams. There'll be a mock exam for microbiology. Sonal Pradam, are you not able to see the screen? I have fixed the screen already. Are you not able to see it, Sonal Pradam? So there will be a microbiology exam question paper discussion. It will be approximately 30 to 40 questions from real-time exams. We'll be discussing on Unacademy app 10:31 p.m. 17th November. And this is how you can use the code. You can try Unacademy on Google Play Store or iStore. Then you can open the app after downloading. You can go to plus courses. You can go for subscription. Then you can look for the NEET PG subscription as either a plus course or iconic subscription. You can use 10% off when you use the code. And when you use my code Dr. ASM or ASMYT, you will get 10% discount plus exclusive access to all my free classes and plus classes. So let us begin this. Yes. Okay, so I'm starting the session here. We're starting with this particular area. So have you joined? Can you go to the top area? Look at it here. Shall we start the quiz? Yes, thank you very much. Smitha, Priya, Sai Sudhir Reddy, Sonal Pradhan, Aman Agarwal, Balaji Ramasamy, Sesha Gopalan. We are starting the quiz right away. Go to menti.com and use the code 2322933. So because of the small glitch we had, some of you might be annoyed. I'm really sorry about the small glitch here, because through the glitch I was not able to see the screen properly, and you were also not able to see the screen properly. Now I hope it is fixed. Now, yes, we are ready. Now, at the end of every question, if you want an explanation, please put R or E. E stands for explanation. Please ask me for explanation if you want. So shall we start? Please put a thumbs up if you all are ready. The moment you get ready, please put a thumbs up. We'll start away. Excellent. Yours, Tamil, Shri, Varsha, Purvajradi. Excellent. So let's start with the first question. Answer fast to get more points. Please be on your toes. The virulence factors of Staphylococcus aureus includes all except. Think about the virulence factors. Is it protein A? Is it exfoliative toxin? Is it M protein? Is it Panton-Valentine toxin? Among the four, which one is not the virulence factor for Staphylococcus aureus? Okay, we have 45 seconds more. Come on, people. Okay, Himanchala, I request you to use the menti.com and use the code 2322933, because that will actually take into your account whether you get the right answer or not. If you answer faster, you will be playing for points. If you answer here, you will be correct. I'll be happy, you'll be happy, but the world will not know that you got it right. But if you get it wrong, the world will know that you got it wrong. That is why I'm asking you to go to menti.com so that you can use the code 2322933. Okay, Lakshmi Krishna, yours, Purvaj ready? Yes, yours. You can use the thing in the same phone. Most of you have gotten the right answer. 27 out of the 45 people have given the right answer. So protein A is definitely a part of Staphylococcus aureus. Remember, protein A and coagulase are called as twin proteins of Staphylococcus aureus. I'm giving you a very short description. This is INI-CET. So to help you go for the central exams, I'm going to teach you some simple tricks here. Listen very carefully. Protein A and coagulase are called as twin proteins of Staphylococcus aureus. Protein A blocks the binding of an antibody with the complement factors. So when the complement factors are bound to the antibody, which is in turn bound to the organism, then complement mediated attack of the organism can be avoided. So protein A can be helpful. At the same time, coagulase is also referred to as The clumping factor, if it is bound coagulase, and you can also have free coagulase, it converts fibrinogen into fibrin meshwork that is capable of creating a layer around the organism. The layer around the organism can give the organism toughness and thickness. So coagulase and proteinuria are the primary virulence factors of Staphylococcus aureus. Exfoliative toxin is actually the Staphylococcal Scalded skin syndrome toxin. Panton valentin toxin is also called as leukocidin. This leukocidin is capable of breaking down the WBCs. So A, B and D are absolutely true statements of virulence factors for Staph aureus. Can you tell me M protein belongs to which organism, people? Can you please tell me M protein belongs to which organism? M protein does not even belong to Staph aureus. Does anybody know? Excellent, all of you. Very good. Very good, Tawheed, Tamilarasan, Jamini, Raji, and Swarnalatha. It belongs to Streptococcus pyogenes. That is why option is C is the right answer. So let's go for the next question. I have given you enough amount of data. Is it okay for you people? Okay, now we see Bharti Wellness on top, Shreethi second, Sesha third, Jaimini third, fourth, Natalizumab fifth, Karthik sixth, Dr. Strange seventh, Saranan eighth, Mr. King ninth, and Arun RPAG 10th. Excellent playing, people. Now let's go for the next question. So, second question on your screen now. Answer fast to get more points. Atypical pneumonia can be caused by the following microbial agents except Mycoplasma pneumoniae, Legionella pneumophila, human coronavirus, and Klebsiella pneumoniae. Among the four, atypical pneumonia is not caused by which one? Okay. Sonal Pradhan, Himanchala, Yash Jadhav, Purvaj Reddy. I'm really happy that you're giving us the answers, but please use menti.com. It's just a request. It's up to you. You can use menti.com and use code 2322933. If you could use this, your answers will be taken into consideration. Yes, we'll be having the seconds coming up. So let me tell you what is the meaning of atypical pneumonia. Excellent, people. 33 out of 70 people are given the right answer. That's a well played game. Now listen very carefully. Atypical pneumonia would mean to say that you don't have classical features or typical pneumonia features. You will be looking for proper consolidation, red hepatization, gray hepatization. All these stages are properties of typical pneumonia. But think about it. When I use the word atypical pneumonia, we are not supposed to consider the atypical organisms not to be out of the equation. What does it mean? See, if it is typical pneumonia, the causative organisms will be typical. If it is atypical pneumonia, either it can be atypical organisms or it can even be non-infectious chemical kind of pneumonia. Here the point of concern is, when I speak about Klebsiella pneumoniae, among the given four options, Klebsiella pneumoniae is the only typical bacteria. How do I know it's a typical bacteria? Mark my words. A typical bacterial infection is also referred to as pyogenic infection, also referred to as septic infection. When a bacteria is able to attract neutrophils to the site of infection. I repeat, when a bacteria tries to attract neutrophils to the site of infection, in that particular attack, neutrophils and bacteria, both of them are attacking each other. Some bacteria may die, some neutrophils also may die. Dead neutrophils are referred to as pus. So please remember, typical bacteria are the ones who are dealt by neutrophils and they will be having pus. So they're also called as pyogenic infections. And when there is a pus, if the toxins are also present, then that will be called as septic infections. So septic pneumonia, pyogenic pneumonia, typical pneumonia are all caused by Klebsiella. So how do you remember which bacteria are known for atypicality? Let me tell you this right now. Listen very carefully. All mycobacteria, Mycoplasma, Rickettsia, Chlamydia, Legionella, and ultimately spirochetes. I repeat, mycobacteria, Mycoplasma, Rickettsia, Chlamydia, your Legionella, and spirochetes. These are the major atypical bacteria. So in this case, you understand that Mycoplasma and Legionella are obviously atypical pneumonia causing organisms, and all viruses are known for causing atypical pneumonia, no doubt about it. Why is these organisms special? Because the organisms I told you, let me repeat one last time. Legionella, Mycobacteria, Mycoplasma, Rickettsia, Chlamydia, and then you think of spirochetes. All these organisms are mostly intracellular, and all viruses are obligately intracellular. So only when the organism is extracellular, it can be pyogenic. So Klebsiella pneumoniae is an extracellular organism. This is a classical case of a typical bacteria. That's why the answer is D. Let's go for the poll right now, leaderboard. Sriti, Sesha, Natalizumab, Saranan, Mr. King, Priyanka, Summi, Sayantan, Halala, and Pushka. Okay, Sesha is on top. Sriti, Mr. King has given the fastest answer here. Let's go for the next question. Use menti.com and use the code 2322933. Question 3 of 7. On your screen now, answer fast to get more points. In a 5-year-old boy with recurrent respiratory pyogenic infections with capsulated bacteria, which of the following investigations should be done? This is a previous repeat question. Are you going to measure IgA levels, IgG1 levels, IgG2 levels, or IgA and IgG2 levels? Which one? Go for the answer, people. Hello, Lasya Lingam. Welcome. Okay, so we have 15 more seconds. Please turn in your answers. The most important keywords are recurrent, respiratory, pyogenic infections with capsulated bacteria. 4 things to be taken into consideration. It may be a 5-year-old boy, it may be a 10-year-old boy. This particular scenario will not make a difference right now. Please understand, because it's a 5-year-old boy, you are able to find it out early. Now, this question can be tricky because most of the time you will be able to make mistakes here. When I said respiratory, think of IgA antibodies. Why? Because think about the 4 important tracts of your body. Think about the 4 important tracts of your body. GIT, GUT, respiratory tract, ocular epithelium. Let me repeat. The gastrointestinal tract, the respiratory system, the genitourinary tract, and the ocular epithelium. In all these 4 areas, your body is directly exposed to the external atmosphere. So you are in for exposure to dust particles and bacteria and viruses or whatnot. So if you want to protect these 4 areas, tracts, you need to coat the mucosal epithelium with IgA antibody. So remember, mucosal epithelium's Forssman is called as IgA antibody. And I'm really glad you chose IgA. But the question did not stop there. They said recurrent infection. If this boy alone is having a recurrent infection, it means it is not the problem of the community. It is the problem that is present in the boy itself. So he is having some immunodeficiency. That's why we are looking for an antibody deficiency here. It means when you have recurrent respiratory pyogenic infections, remember, in case of pus, the most important antibody you think of would be IgG. So you have capsulated bacteria. For opsonization, you will be focusing on IgG antibody, IgG2, and also for IgA with respect to respiratory pathogen. So that is why we have to look for the combination of IgA antibody and IgG2 antibodies to get the best results. So let's go for the 4th question. We have a few more questions. Come on, people. Be on your toes. Let's start the 4th question right away. The factor determining whether the antibody will remain membrane bound or get secreted is what? Is it RNA splicing? Is it differential RNA processing? Is it class switching? Or is it allelic exclusion? So this is a combinatorial question between that of biochemistry, molecular biology, and microbiology, along with that of immunology. So in this one question, 4 different subjects can come into the equation. They are saying that if, for example, IgA antibody is taken into consideration, will the IgA antibody stay bound to the mucosal epithelium, or it can become a part of respiratory secretions, GI secretions, urinary secretions, or tear secretions? Will it be bound to the membrane or get secreted? This is our question right now. What factor determines it? So remember one thing. Okay, I am getting your answers. The one thing I'm really sorry is that when you get the wrong answer, everybody will be able to see it through the comment section. That is why I suggest you to go for the Menti quiz. If you give the wrong answer, nobody knows. If you get the right answer and if your name comes on top, everybody will be able to see it. Okay, the right answer would be differential RNA processing. RNA splicing is a part of post-transcriptional modification. Please remember, 27 out of 70 people have chosen class switching. Remember, class switching is important for converting an IgM antibody into IgG antibody, or one class of antibody becoming another class of antibody. But what is my question here? We are looking for whether the same antibody called as IgA is deciding to be bound to the membrane or is getting secreted. You're looking for the J chain component, the joining chain component, whether it can be introduced or not. For that, you require differential RNA processing. What is splicing? See, whenever transcription has happened, the transcriptome is actually called as heteronuclear RNA. Now that transcriptome can contain both exons and introns. Introns are interfering codons. So if you want to remove the introns and splice the exons, that is called as RNA splicing. That is the basis of production of any kind of active protein. So it can't be RNA splicing. It is definitely not allelic exclusion. Please read about differential RNA processing when you have time. That is the right answer for how you are able to convert a membrane-bound compound into a secreted kind of antibody. So let's see the leaderboard here. So Shruti is on top, Sesha second, Summi, Sayanthan, Saravanan, Priyanka, Tawhid Khan, Natalizumab, Sweta, Dr. Strange. So Shruti has given the fastest and she has displaced everybody else. Let's go for the fifth question for the day. And false about Staphylococcal Scalded skin syndrome. Which one is false? Is it caused by exfoliatin? Has another name called as toxic epidermal necrolysis. Newborns, if affected, are referred to as Ritter's disease. The antigen binds to groove between alpha and beta subunits of T cell receptor. Among the following, which one is the false statement? Allelic. For example, Naga Karthik is asking me a question. What is allelic exclusion? Allele means what? For a given particular character, there are two zones in a given DNA. When you have double-stranded DNA, two zones have the same information. If one particular zone is removed, that is called as allelic exclusion, which is not at all related to the given question. That is why it is not the right answer also. Okay, there are so many people who are giving us the answers through the comment box section. I'm glad you all are interested. Thank you so much for playing. Are you all liking the questions? I could have made it as a theory session, but it would be boring for you. That's why I'm making it as a quiz session. If you're all okay and if you want more, we'll do more sessions in the coming week. Tomorrow, day after tomorrow, continuously we'll be having till the INI-CET exams. Please let me know if you want it. Please let me know in the comment section if you would want it. Okay. So now think about the Staphylococcal Scalded skin syndrome. This Staphylococcal Scalded skin syndrome can attack both infants and the adults. Remember, infants are always more severely attacked than that of adults. Infants are more commonly attacked than that of adults. If infants are attacked, they are called as Ritter's syndrome or Ritter's disease. So obviously option C is absolutely correct. Now look at this part. If the same thing is attacking an adult, you can call it as TEN, toxic epidermal necrolysis. So the same Staphylococcal Scalded skin syndrome, tetra S, which is caused by tetra S toxin, which is also called as exfoliatin, that is option A is true. If it is attacking adults, you call it as TEN. Attacking children, you call it as Ritter's syndrome. So option A, B and C are absolutely true. But focus on option D. What are the mistakes in option D? Point number 1. Staphylococcal Scalded skin syndrome toxin or exfoliatin is not an antigen, it's a super antigen. And because of which option D is absolutely wrong. Also, only if it's an antigen, it can bind between the alpha and the beta subunits of the T cell receptor. If it's a super antigen, can you tell me where it binds? If it's a super antigen, imagine if it's a super antigen, there are two pillars here, alpha pillar, beta pillar. It does not sit in the groove between alpha and beta pillar. It comes and binds directly to the lateral wall of the beta pillar of the T cell receptor. So on that basis, option D is the wrong statement. Let's go for the leaderboard here. Thank you very much. So, okay. Thank you, Purvaj, Na Karthik, Tawheed, Sheikh, Priya, Subodh, Tawheed Khan. Thank you very much. Okay, Shruti is on top, Sami second, Saranan third, Sesha fourth, Sayanthan fifth, Priyanka sixth, Tawheed Khan seventh, Natalizumab eighth, Sweta is ninth, and Kiki 10th. Well played, people. Now we go for the sixth question. We have two last questions to play for. See whether you can make it to the top 10. Well played, people. Come on, we can do it. Incorrect about characteristic features of gram-negative Eubacteria. Remember, there is something called as Eubacteria, and there is something called as pseudobacteria, and filamentous bacteria. We are focusing on Eubacteria alone, and if it's a gram-negative Eubacteria, these are the 4 options. Can exist as spherical rods, filaments, may be motile by flagella. All are motile by peritracheate flagella. They can be grown under artificial culture medium. Which of the following statements is the wrong statement? Yes, we have 3 more seconds. Okay, so 37 people have given the right answer out of all the people who have tried to answer this question. Very well played, people. Nice. So what do you think is wrong here? Anybody? What do you think is wrong here? In this question, what do you think is wrong? Okay, I'm so sorry. If you would want to see the options better, you could use the landscape mode on your phone. I'm sorry. I did not actually keep it this way. When I feed the data into the app, this is how it comes out as, because it looks like a very lengthy option. I'm sorry about this. Next time I'll keep very short options. So please forgive me. I'm really sorry. So here the problem is they are saying that all the gram-negative Eubacteria can have peritracheate flagella. Can you give me an alternative example? Can you give me one simple bacteria who does not operate based on peritracheate flagella? Anybody? Can you give me example of a bacteria? Very good. Some are saying that all are not motile. Very good. That is option number 1, because Klebsiella is actually the cousin sister of E. coli. E. coli, Klebsiella have the same kind of credentials, but E. coli is ruling the world in being the #1 cause of UTI and being the #1 bacterial cause of diarrhea. But Klebsiella is always playing the second fiddle. It is the second most common cause of sepsis, UTI, etc. So what is the difference? E. coli can run from one place to other, but Klebsiella is not able to run. It is physically challenged. What does it mean? This particular Klebsiella does not have the property of moving, so it is non-motile. So Klebsiella is a gram-negative bacteria, non-motile. Also, if it is motile, it is not always by peritracheate flagella. Can you give me one example? Excellent, Parthasarathi. Vibrio is an example of a unipolar flagellum, which can give you darting motility. Nice, played. Okay, let's go for the last question, the leaderboard here. Shruti is on top. Okay, Shruti is on top. Sayantan, Sammi, Sesha, Saranan, Priyanka, Tawhid Khan, Natalia Zumab, Sweta Satish, and Kiki. Now let's go for the last question. Yes, Yashado, correct. Monotrichous. The last question. And let me tell you, at the end of the session, if you have any doubts to clarify, any questions about NICT you have, please let me know. I'll try to answer your questions. The last question begins now. Answer fast to get more points. Which of the following bacteria is associated with Forssman antigen? Is it Staph aureus, Bacillus anthracis, Yersinia pestis, Streptococcus pneumoniae? Which of the following bacteria is related to Forssman's antigen? This can be a tricky question. Try to answer this as much as possible. Okay, Nagashiromani, Arshi, Dr. Svan, Darshana Jagadana, Ram Kumar, Pardasarthi, Faria, Donu, Faria, Himanchala, Subodh, Neeraja. All of you are giving me answers on the comment box section. Absolutely fine, no problem. So let me give you the concept here. The right answer would be Streptococcus pneumoniae. Only 5 out of 90 people have gotten it right. Only 5 out of 90 people have gotten it right. Listen very carefully. Forssman antigen is based on the teichoic acid. Teichoic acid is a structure that differentiates what from what? Anybody? Teichoic acid is a structure that differentiates which bacteria from which bacteria? Can you please tell me? Anybody? Can you please tell me? Teichoic acid, T-E-I-C-H-O-I-C, teichoic acid differentiates which bacterium from which bacteria? Excellent, very good. Gram-positive bacteria from gram-negative bacteria. So you can take into consideration both Staph aureus and Streptococcus pneumoniae to be the gram-positive bacteria. Bacillus anthracis is a gram-positive bacillus. It's not a coccus. Yersinia pestis is a gram-negative bacteria. So on that basis, option C is already ruled out. Now look at the concept of Forssman antigen. When you have the teichoic acid of the cell wall, along with that of M protein or related protein, then that will be constituting the Forssman antigen as given from Harrison, as given from that of Warren Levinson and that of Javits. Streptococcus pneumoniae is that special bacteria who will be able to have the teichoic acid as an important antigen, and when the altered M protein that is belonging to Streptococcus pyogenes, when they both come together, you will call them as a Forssman's antigen capable of stimulating an immune response. So for the time being, please understand, Streptococcus pneumoniae is the organism who has the Forssman's antigen. There are many people who actually chose Staph aureus. It cannot be definitely Yersinia pestis. It is not Bacillus anthracis. It's not Staph aureus. The best answer would be Streptococcus pneumoniae. There are certain authors who might argue Staph aureus is gram-positive cocci. It contains teichoic acid, but there is no M protein in case of Staphylococcus aureus. That is the only reason why it is not the answer. So I hope I have given you the answer and the explanation. Let us see the leaderboard right now. Oh, thank you very much, Na Karthik and Yash Yadav. Okay, so the only person who got the right answer for this question was Sayanthan Basu. Sayanthan Basu is on top. Shriti, Sammi, 23, Saranan, Priyanka, Tauhid Khan, Natalie Zuma, Sweta Satish and Kiki. Okay, people, now we are done with the questions, and I'm just giving you a chance to ask me any questions. You can ask me any questions you feel like. Do you have any questions? If no questions, we'll conclude. Tomorrow at 7:30 p.m. we have a clinical case discussion. Tomorrow at 7:30 p.m. we have a clinical case discussion on infections, on infectious microbiology. Please remember, it will be a very long case. We'll see how you will be able to crack open the case depending upon the data given in the case history. Any other question? Priya Ashok, the next plus class is right now at 7:30 p.m. We have the special class, this is the plus class only for subscribers at 7:30 p.m. to 9:30 p.m. and the next session can be 10 p.m. to 12 p.m. This is for the plus subscribers, and if you would like to subscribe, that is for 1 month or 2 months until the INI-CET, you can use my code DRASM or DRASMYT. Tonight we'll be having 4 hours of class. In 4 hours of class, we'll be discussing threadbare about the last minute revision points about INI-CET and certain previous exam question papers. Any other question? Yes, Streptococcus pneumoniae is the right answer because Streptococcus pneumoniae will contain the teichoic acid because it's a gram-positive bacteria, but also it contains a variant of M protein like that of Streptococcus pyogenes. The combination of teichoic acid with that of M protein will be together called as Forssman's antigen that is capable of giving you lectures. Okay. How can we remember Streptococcus classification? I have taken a class on Streptococcus classification threadbare by describing why exactly classification needs to be done and how exactly classification is done. It will be making it easier for you. Thank you very much, Subodh. Vibrio Yeltor and Vibrio cholerae. See, Vibrio cholerae is actually divided into Yeltor and classic. It is not Vibrio Yeltor and Vibrio cholerae. Vibrio cholerae classic and Yeltor. Yeltor is a structurally tough organism. It can survive in abrupt atmosphere changes. But classic is a very fragile organism. So when you make any changes in the environment, classic will not be able to survive, but Yeltor can survive. But at the same time, classic is more pathogenic than Yeltor. Yeltor is less pathogenic than classic. Generally, the concept of subclinical cases is nil in case of Vibrio. But if at all there are cases appearing as subclinical, then in case of Vibrio, Yeltor has more subclinical than that of classic. These are the 3 major differences between that of classic and Yeltor. Next Menti session will be on 18th. Next Menti session will be on 18th, but not just the Menti session. As I told you, tomorrow we'll be having a case discussion. This will prepare you for your university exams. This will prepare you for your central exams. This will also prepare you for the NEET exams, because the upcoming NEET exams are all integrated. So tomorrow we'll be having a very lengthy case discussion at 7:30 p.m. Tomorrow 7:30 p.m. we have a free YouTube session. Tonight 7:30 p.m. to 9:30 p.m. and 10 p.m. to 12 p.m. we have a class on INI-CET for Plus subscribers. And all of you, thank you very much for being here. Have a great evening. I'll meet you tomorrow on YouTube at 7:30 p.m. Good night.